It could be argued that we are never more physically vulnerable than when we undergo surgery. Thanks to modern medicine, surgeons can perform the most complex of procedures, all while the patient is in a medically induced state of unconsciousness known as a general anaesthesia. But of course, while you're unconscious, the anaesthetics team need to monitor all your vitals, and often they need to manage your breathing mechanically. The anaesthesiologist generally does this using a technique called intubation. Intubation is not without its risks, particularly for singers and their voices, so today we're going to briefly discuss the impact that general anaesthetics and endotracheal intubation might have on your voice.
Sound check. Check 1, check 2.
Hello everyone, welcome back to Voice Essentials, where everybody sings. My name is Dr. Dan and I'm a contemporary singing voice specialist. It's my job to help you realise the full potential of your singing voice. Odds would suggest that at some point in your life you will undergo surgery, which in turn will require a general anaesthetic. In developed countries like Australia and the US, we are fortunate enough to have access to some of the best medical teams in the world who use the most advanced techniques. One area of modern medicine that continues to evolve is that of anaesthetics. Of course, one of the major benefits of general anaesthesia is the suspension of our natural physical response to pain. But to suspend our natural protective reflexes, the anaesthesiologist must also take control of certain automated systems such as our breathing. The anaesthesiologist will commonly manage your breathing using a technique known as endotracheal intubation. More often than not, intubation is performed using an endotracheal tube, also known as an ETT. Now I've got an ETT here to show you. Now once sedated, the ETT is inserted into the patient's mouth and down into the trachea. The anaesthesiologist aims to set the glottis between these two markers right here. And once the ETT is positioned, this little balloon on the end, which is hard, might be hard for you to see, is inflated to seal off the airway, preventing any fluids entering the lungs during sedation. Another option available to the anaesthesiologist for intubation is called a laryngeal mask airway device, or an LMA. This is an LMA right here. The LMA is inserted into the mouth and comes to rest over the top of the glottis, but is only preferred when the patient is able to breathe on their own and the risk of aspiration is low. The benefit of the LMA over the ETT is mainly due to the LMA not coming into contact with the vocal folds themselves, whereas the ETT comes to rest between the vocal folds and can cause vocal fold swelling.
Sound check.
Ultimately, the primary concern when you are under full sedation is the surgery at hand, not the health of your vocal folds. So it is important to highlight to your surgical team, in particular your anaesthesiologist, that you are a singer and you would greatly appreciate extra care being taken during the intubation procedure. If possible, ask whether an LMA can be used to avoid contact with the vocal folds. Now, if your procedure doesn't allow for an LMA, then ask your anaesthesiologist if using a smaller diameter ETT is an option. These questions will also serve to stress the importance of your vocal health to your anaesthesiologist, which hopefully in turn will heighten their need to take a little extra care during the surgery. In a great write-up on the subject of anaesthetics and voice, Andrew Rosenberg suggests that another point to discuss with the anaesthesiologist might be the attention paid to extra care taken with the ETT balloon inflation pressures used during the operation. Dr. Rosenberg goes on to say that more commonly the balloon pressure is the cause of post-operative sore throat. It is important that we also note that your individual morphology, that is your physical shape, size and dimensions, will also determine the impact of intubation on your voice. For example, someone with a narrow mouth opening may prove harder to intubate than someone with a more pliable jaw, thus making intubation that bit more challenging. But even if everything goes smoothly, it's not unusual to experience slight hoarseness in the days immediately following surgery that has required intubation. Any sense of altered voice should resolve within 2 weeks after surgery, but if, however, you are still concerned about your voice after 3 weeks, I would advise seeing a laryngologist who can assess the condition of your voice, ascertaining whether or not your voice has sustained any phonotrauma as a result of the recent surgery. I'd also advise you to avoid placing your voice under any heavy load after surgery, such as vocal performances, until your voice has returned to a sense of normal health and sound. You can help expedite this healing process by hydrating well and using a personal steam inhaler. Of course, there are other risk factors, all of which occur very infrequently, so if you are concerned beyond what I've already mentioned, then be sure to discuss your particular apprehensions with your anesthesiologist and surgeon, who I am certain will be able to allay any fears that you may have. Well, this has been a different kind of video today, but an important subject, given that the most of us at some point or another will require surgery, general anaesthetics and intubation. It's information you may not need today, but I hope you're able to store it away for later. Please leave the video a thumbs up if you found it helpful. I'm Dr. Dan. Sing well.